We are grateful for the opportunity to present our poster to you today focused on findings obtained through our ITP Natural History Study Registry on whether IVIG use reduced the incidence of contracting SARS-CoV-2 among ITP patients. This was a prospective cohort study. The goal of our study was to explore if ITP patients using IVIG within the last 6 months were less likely to test positive for SARS-CoV-2. Up until June 2022, we were able to recruit 602 participants into the study. Only participants who answered in the survey if they tested positive for COVID-19 and reported what treatments, if any, they had used within the last 6 months were included. The 602 participants were then stratified by age into 3 different groups. There was a pediatric group, which really represented individuals under 21 years. There were 33 children. Of the 33 children, 22 were under the age of 18 years. There were 472 adults between the ages of 21 and 64 years, and there were 96 seniors over the age of 65 years. Within the pediatric group, 11, or 33%, of participants tested positive for COVID-19. None had used IVIG within the last 6 months. Of the 22 who tested negative, 2 had received IVIG within the last 6 months. Within the adult group, 95, or 20%, tested positive, and 11 or 12% received IVIG alone or in combination with other therapies. Of the 378 participants who reported they tested negative, 36 had used IVIG within the last 6 months. Within the senior group, 7 or 7% of participants tested positive, and only 1 individual, representing 14%, received IVIG alone. Among the 89 participants who tested negative for COVID-19, 9 or 10% had used IVIG within the last 6 months. When comparing the amount who screened positive for SARS-CoV-2 in each of the 3 age groups, there was a notably higher proportion of ITP patients under 21 years of age contracting SARS-CoV-2 compared to older participants, and this was significant. And you can see the spread in Figure 1. You can see that there's a predominance of individuals under 21 years of age compared to the others. Overall, none of the 11 positive COVID-19 cases among the pediatric group reported recent IVIG exposure, while combined 11% of adults and senior participants who tested positive reported recent IVIG exposure within the last 6 months. When comparing positive COVID-19 cases with recent versus no recent exposure to IVIG among the 3 age groups, there was no difference regarding IVIG use. This suggests that IVIG did not reduce the likelihood of contracting the virus if used in the last 6 months. While the recent use of IVIG among ITP patients in our registry did not appear to have a protective effect against SARS-CoV-2 contraction, this could be due to a number of reasons. For one, we were unable to assess if there were indeed active antibodies indirectly transferred to ITP patients receiving IVIG, and if so, were these autoantibodies targeting current SARS-CoV-2 variants in circulation? Another limitation of the study is that we were unable to assess how much IVIG each participant received and at what dose. With anxiety in the ITP patient population over the possibility of platelet count decreases after SARS-CoV-2 viral infection, IVIG efficacy against the virus would be reassuring, as IVIG is commonly used as upfront ITP therapy for ITP patients. Thus, more work in the area is needed. Thank you for listening to our presentation.